Hello everybody, namaste and greetings from my side. Today there's something which is very amazing and important I wanted to share with all of you. So we recently treated a person, she's in the middle 60s, and it's a very history which is really heart-wrenching. At 20 years she got a cancer, then at 40 years she again got a cancer, and now at 60 years she's again getting a cancer for the third time. So previously, both the times it was a hematopoietic, or I would say lymphoma. Unfortunately, she got treated of it. The second time she even underwent a bone marrow transplant and she came out of it. Now this time she got a bilateral breast cancer. So it was cancer both on the right breast and the left breast. Fortunately, the left breast was a precancerous stage, but right breast was a frank cancer. And when we evaluated her, it was a stage 4 kind of cancer. This cancer had spread to the bones also. So we got the latest technology in precision oncology. From a blood sample, we were able to identify what is the disease biology, what is the drugs which will suit her, because for her, since she is a previously bone marrow transplant patient, hematopoietic cancer, so we have to be very careful which chemotherapy drug, which medicine we are giving, because they itself can again trigger another cancer. So we don't want that we are treating her for this disease and she ends up with another disease, which is as dreaded as this is. So it was the onconomics from the RGCC labs. So we understood the exact disease biology. We planned just 6 to 7 cycles of chemo, and within 6 to 7 cycles of chemo, a disease was like, when we got a PET scan done, the whole bone was clean. Every part of metastatic site, there was no cancer. Even the right breast, which had the cancer, there was a very substantial decrease in the cancer. And then we took her up for surgery. Surgery was bilateral breast, so it was a robotic surgery for both breasts. So we used the Firefly technology in the robot. So we were able to identify that we gave a small incision. We went inside the breast. We identified that this is the suspicious tissue. We removed it and preserved the rest of the breast. Similar at the right side, we gave a small incision around the axilla. We did the axillary sentinel lymph node biopsy, and through the robot we went inside the breast. We identified the tissue which was suspicious, which was affected. We removed it with margins and we preserved the rest of the breast. And fortunately for us, what came out was that the tissue which we had dissected, so it was a complete response. There was no viable cancer. It was all cell necrosis from a stage 4 cancer, which was a third cancer. Now the patient is completely cured. She's disease free. We're starting her on hormone therapy with nutraceuticals, and there is no morbidity. Both the breasts are preserved. Even we did not put a drain for when we operated her, and she was out of the hospital within 48 hours. So that is how a technology, both from precision oncology to the robotic surgery, that is how tech can actually make the cancer treatment very precise and very less morbid. And also we can achieve much better results by applying technology. Thank you.